How do I know if this baby is okay? Well, throughout the pregnancy, even if you have done IVF, you can never really know if this baby is okay. Because the only way that we come to know if this baby is fine is when it's born, it comes out crying, it matches all the parameters or all the factors that we measure. So, like, what do we look at when the baby is born? Did the baby cry? Did the baby move? Did the baby suck properly? Did the baby's organs look okay from outside? Did it pass urine? Is pass poop? All these sort of weird things are the factors which decide actually if the baby is okay. Now, how can we tell if the baby is okay in first trimester, the moment you get pregnant? We can't. There is no way to tell if this baby is fine. Only time will tell if this baby is fine. So, in first trimester, when you get bleeding and we go for your ultrasound and you don't see a sac, that's like, depends. Like, if you're like 6 weeks pregnant and there's no pregnancy, then we are like, okay, maybe this pregnancy is not in the uterus. Suppose we find the pregnancy in the uterus and then we see a sac and then we don't see a fetal pole, then we don't know, because those are the parameters at that time to see if this baby is normal. If at 6 weeks I see a sac and there is no baby inside, I'm going to think, okay, maybe this baby is not okay, and we're going to follow it up. But if we see a fetal pole and there is heart in it, that's reassuring. So sometimes by 8 weeks we call the patient, there is everything. There is no bleeding, I see the baby, I see the heart, it's good to go. For me, this is a good baby. But do I really know if this is a normal baby? No. I will know only when the baby is born. Time will tell. Now, there are so many tests that we do in pregnancy, and I will talk more about them. Throughout the pregnancy, we will do like NT scan, we will do triple test, quadruple test, anatomy scan, NIPT, amnio, CVS. These are the tests to see if baby has 3 genetic defects: Downs, Patau and Edward. They are trisomies or sometimes Turners. Just to see if the baby has these 3 or 4 problems. That's it. Sometimes if there is a genetic condition in the family, like the patient has actually lost a lot of babies and she has met an embryologist, geneticist, and they have actually found out that there is a problem in the family, if they're married cousins or there is a known genetic problem, then we can look for that gene specifically in the baby. That becomes very specific. But not everyone has a genetic problem in the family. Most of us are fine. We don't have these problems. So if you're watching this video, probably you are a low risk patient, because if you're a high risk, you come to a different package. But I still bring my high risk patients in this portal as well, because they get to know so many other things. So there is really no way to tell if the baby is normal. Even if we did those gene tests, there can be something else wrong. We don't know. So we have to have faith that this baby is okay. You really have to believe. Because what do you have to lose if you don't believe? Think about it. The worst that can happen is a disappointment that, oh, this baby is not okay. But what if this baby is okay? Then you just wasted all your energy and your feelings and thoughts into worrying when this baby was absolutely fine, because that sort of worrying is actually putting stress on the baby. Why would we want to do that? And that's why you're here. So catch yourself worrying over things and let me know what you're worrying about, and let me help you out to see if if it's something which your brain should actually worry. Actually, worrying is always unnecessary. It never brings any good. Think about it.